I know some of you, it seems like are calling in. So if you need to switch your methods of listening, we understand that. And again, all the sessions will be recorded in different segments. So if you miss a segment, you can pick that up or share it, hopefully, with other members of your team. Anything else, Becky?
I was going to say, Christina, something just to kind of go back to some things that you talked about earlier, and some things you really said kind of hit home in that, for instance, a 4-H fair in an area. Our family's a big 4-H family, much like Elizabeth, and I just think never had it ever dawned on me that that would be a targeted event, and how important it is now to make sure that the leaders of those groups are very on top of this, and what other kind of events go on in our community, because it's now, I think, you know, you think you shelter your kids, but now it's like, as children, they were probably exposed to things that I had no idea of. So it really kind of drove home that, you know, while you shouldn't walk around paranoid all the time, there does definitely need to be an awareness of what potentially could go on. And I'm not so sure that we address that well in our community. In fact, I'm sure we don't. So just something that you said earlier that has just been twirling in my head ever since you brought it up is, you know, every county has one, and that's one of the top events. And then you think the state fair is just huge. We think of that as a big family event too. And while you know to be cautious there, not cautious maybe about these types of situations and what may be going on right underneath your nose. So
we have a subject matter expert named KD, just the initials, K and D, Roche, R-O-C-H-E. And KD's story involves being trafficked by an uncle, new to the family. And part of what happened was they would take Katie when she would go visit in the summertime. They would go to various different, and Katie was not trafficked in Indiana, but they would take KD to various different venues and a lot of state fair or 4-H fairs, state fairs type situations. And they would trade like work, where they would allow someone to go to the horse trailer they had, and they would basically have sex with KD. And then they would get shoes for their horses or whatever it was. And then eventually it did turn into a lot more money and different things. But so, yeah, that can happen, unfortunately. But any, like I said, anything that draws a crowd to the community that you're in can be a big factor to it. So I appreciate your comment, though. Anything else before we get going and switch gears a little more about the healthcare side?
This is Allie. I'm mostly a participant to help with the IT and the technical side of it, but I think maybe what sticks out to me, and you can 100% correct me if I'm wrong, but what I hear as you speak is maybe not that we need to be hyper vigilant for our own kids and, you know, always watching out for those strangers or, you know, someone that's going to snatch our own kids. Not that those things don't happen. Absolutely, those things do happen. You know, the 9% is not insignificant, but that we need to be aware for the signs and be watching out for the signs in our community to be able to help those people in our own community that this is happening to. Is that what I'm hearing is the real danger? We so often see these watch for somebody putting something under your car in a parking lot. Don't stop to pick something up when you're out running on a trail. You know, those posts we see on Facebook. But maybe that's not the clear and present danger that we should really be focusing on. Is that what I'm hearing?
And that is a lot of it. I do like the way you said that, because I mean, we do have to worry about strangers, because people, like I said, are creepy and weird and do a lot of really weird things. But I mean, as community members, there are so many different things that we can see. It's just that there, again, that education and different things that weren't there, so people don't see them. So there's so many signs and red flags that are missed. But yeah, there's so many things that we can do as community members to see a lot more, to maybe help out or to just make those reports. I always say, like, if you see something, say something. And at the very end, I'll show a video if I have time, where one of the Indiana State Police detectives says, I'd rather investigate a tip and it turned out to be nothing than someone being trafficked and never being rescued. So yeah, as community members, there are so many more things that we can see and help with if we just get that information education out there.
Christina, I think this is a good point too, as we're transitioning into talking to healthcare workers. And, you know, if you see something, say something. There are signs that you can be aware of as healthcare providers and healthcare workers. Going back to our previous education last time in January, where we talked about those modalities and those methods, we talked about motivational interviewing, we talked about the craft methodology and model. Those pieces really are going to fit into your daily practice here, to begin utilizing those as far as motivational interviewing with your patients. How do you use the craft methodology to establish rapport with patients or members out in the community? So this is a great segue into that, and just kind of wanted to remind you guys what we learned last time in January, and those different modalities of therapy and communication methods that we talked about is really going to tie in right here, where you can kind of see how you can use that to change your practice a little bit.
Okay.
And I think too, it's so eye-opening because you start thinking back. It's like, you know, thinking back now, I remember kids on the bus that they were totally going to Green Acres truck stop and getting trafficked. Now I know that. But you know, at the time you didn't get why their mom would take them there. And then all of a sudden the mom was getting money, and then they had a nicer house, and then the girl's pregnant and doesn't know who the dad is. Like, now it makes sense, but I mean, you know, you just don't see it. But yeah, this is just, it's so eye-opening. And I think as healthcare providers, you know, you're in a unique position to really be able to help with this. And as I talk to I want to share this quick story. So this is a rural FQHC, but it's a really rural county. And they were able they didn't really think they had a human trafficking problem where they were, even though they are located off a big interstate, but they didn't think they had a human trafficking problem. And they just put cups in their urine, and it said, you know, something, if you weren't being controlled to pee in the pink cup, you know, if somebody's controlling you to pee in the pink cup, otherwise you can pee in the blue cup. And right within like their first month, they caught multiple people being trafficked. And then they had to figure out how to deal with that, because again, the traffickers always have somebody with them. That was the only time that they were ever alone, was when they were giving their urine sample. And it wasn't just the little call this number for help, because they would probably never be able to do it. But again, the person with them had no idea, because you stick the cup in the little trap door and shut the door, so they could never see that or anything. So again, that clinic on the eastern side of the state, really rural county, has already found it. So I know that it's you know, happening everywhere. So
That's interesting. I like that idea. Those cups for if you're in danger, and if not, it'd be really good. And we kind of get to that a little bit more, where, you know, like a controlling adult partner, there again, because there's a lot of people that tell them what they can and can't say, what they can and can't do, and so they're trained. So yeah, and we have a couple of videos too, that a couple more videos, so that'll cover some of that. Right, very good comments. Anybody else?
This is Stephanie Laws, and I just want to offer that, you know, it is, to echo Elizabeth's comments, very eye-opening, you know. And as we went through these cases, a specific case that I was called in the middle of the night for some legal guidance from a 17-year-old that was in the emergency room. She was staying with her quote boyfriend at one of the local state parks. And, we didn't have a consent for treatment. And, when you go back and rewind the tape on that and you think about, was she in danger? Was she down here without her parents against her will? Those items stick out profoundly. And I guess I'm also wondering, what role has the pandemic played in the identification of sex trafficking victims or human trafficking victims? Because the hospitals have largely changed their visitation policies. There's usually limited visitors. There's maybe this concept that I'm thinking of a lack of seeking medical attention and medical care because of this change in the dynamic of the healthcare system, given the lack of somebody to provide that oversight at the bedside or to control what that individual says. And also, it would appear that these individuals may be in more danger because of not only just people being isolated because of the pandemic and the economic shutdown and such, but I think that throws a different challenge to this whole paradigm to be able to understand and identify these victims.
We haven't had a whole lot of medical, I think, issues coming up. Unfortunately, I know some of them are probably still happening, but I haven't heard of a whole lot of stuff going on. But COVID has changed a lot of things. In the beginning, I had a lot of calls, like right off the bat, about human trafficking potential cases and stuff like that, and some DCS involvement and different things. But I think was the biggest ones that I had gotten in the beginning. Then I had another call too that involved a panhandler. An older gentleman was being forced to panhandle by a trafficker. Then she kept and took all of his money and was also taking his Social Security check from him and different things. So that was another one. But I mean, yeah, with COVID, I mean, it's creating more isolation and the feelings and thoughts of isolation to our youth. So they're online more, they're meeting more people. Those different factors and stuff have been an impact. Yeah. But it is still happening. We have not had big events and different things and stuff. I just think they've been a little more secretive about things. And there are so many ways too, where, you don't go to the local street corner anymore. People are doing everything online. And so dark web and different things. So people from their home can just go ahead and still order somebody and get someone from their house in that kind of way too. So that's been another big issue with the whole COVID pandemic going on right now. So
another question that I have, this is Stephanie again, is that has the research demonstrated any correlation between youth suicide rates and that final call for help to get out of the situation? And, I think back like when these people come into the emergency room, suicidal, maybe cutting, there's gestures. I can think about a few situations, again, as we went through this topic of conversation and thinking about calls that I have received as the administrator on call to, is that the last resort? Is that rock bottom for some of these individuals where they have this final attempt that they are able to commit this gesture to get them out of the situation? And I don't know that those questions are really being asked.
Suicide is definitely a big thing when it comes to human trafficking, that they feel that whether they're still being forced into that lifestyle or even afterwards for many years afterwards as well. Aubrey actually does a full documentary that I have seen before, and she talks about how, there were some issues and different things where she had thought about committing suicide and stuff after she left the situation. And I usually don't tell everyone this right this early in the presentation, but she had a younger sister who she was always, and one of the reasons she stayed in her situation for at least a year was because she was afraid they were going to try to pull her sister into it. And so when she finally made the break to get out, she went to live with her grandmother. Well, her sister did get involved with trafficking. I don't know if it was the same people or not, but her sister ended up committing suicide. When Aubrey had, I think, tried and attempted, but was never successful. So those are some definitely big mental health issues that we do face from victims of human trafficking. I don't know there's a lot of research or statistics out there about it. I can definitely look and see if I can find any, but I don't know any straight off the top of my head.
Stephanie, I think you bring up a really great point. And from my own 20 years of experience in emergency medicine, being that frontline healthcare worker, especially in the ER, I think what is really important for us as professionals and in this kind of little niche group as far as ER, or even a rural health clinic, a FQHC, oftentimes we are the front door and very often the last door that those individuals go through. And that's really kind of been my push for this presentation and this project from the get-go, is the courage that it takes these individuals, whether they're dealing with substance use disorder, whether they're a victim of human trafficking, whatever it is, the courage it takes for them to actually walk through the front door. And when people don't know where to go for help, who to reach out to or whatever, it's always the ER. The ER seems to be the end all be all. We don't know where else to go. We're going to the ER. And really identifying those people, I know the language and I know the lingo and the terms that we use from an ER perspective, a frequent flyer, really trying to understand, why is that person a frequent flyer? Because they need help and they need resources that they don't know where else to turn. So they're turning to the ER. And as the front door of that, if they are met with language that dehumanizes them, I'm too busy for you, I don't have enough time, here's a pamphlet, good luck, try to call this number, we've actually added to that problem. We've added to that stigma. And so I think it's being very mindful and acutely aware of our own facial expressions, the words that we're saying, the language that we're saying, and truly understand, for somebody to walk through the front doors of the ER to ask for help, that takes a lot of courage and a lot of vulnerability. And we need to be in that position where we build that person up and not shame them for their situation. So I think you just brought a great point to that, Stephanie, and us really stopping to ask those questions. How often is this happening?
Very good point. And I'll get to that too a little more in what I have to share. But let me hurry up and get going so we can get it all covered. I do like the questions though in the comments. So as a healthcare provider, you guys have a really unique role. And just like some of the great things that Deanna just said, there's going to be a lot of victims who are going to only present at the emergency room at some point in time, or in a healthcare facility setting, because sometimes that's the only place they can go. And there again, like even this says, your point of contact with them is a rare opportunity that a lot of people aren't going to get, because there's so many different things you guys can do as healthcare providers that other health officials can't do because of the setting that you're in. So you do play a really important key role to that. And point of access, you are the third point of access for most human trafficking victims. So a lot of times they interact with friends and family. There is some interaction with law enforcement, but the number third access point is going to be healthcare services. So definitely keep that in mind as a big point. I mean, we got to think, what were we looking for? So this is images we do not like to show when we depict human trafficking, because this is not what we are looking for. A lot of people tend to think that everyone's bound, that they're chained, that they're being tied up. A lot of victims are emotionally bound and connected to their traffickers, the threats, the climate of fear they live through, that they feel they can't just leave or just walk away from that situation. Maybe they feel like Aubrey's situation. She felt safer with her traffickers and felt like she belonged more with them than she did at home, because she didn't receive the same love, emotional support, and feelings as she did with the trafficking family. So definitely be aware of that. Some of the different stuff that we do see in those issues. They are not bound, they're not chained. They might have some extra locks and stuff on the door. They can't freely come and go, but it's not quite this type of situation. So here's a short video clip. Now this one, it might be really kind of hard to hear, because it can be kind of sad in some ways, some of the stories and stuff they go through with this. It can be kind of triggering, and some of the things, and that's with all of the information that we do share can be triggering. So we want to make sure you are doing self-care in case you need it. But it's definitely just some things that can be missed signs, and different stuff and bad stuff that has happened in medical history with some of these stories. So a couple of victims will share a little bit what happened to them with their medical experience. So just keep in mind, this is just some things that happen. This is why we want to better the situation. So.
I had found out that there are these things called escort services. And I thought that I was like moving up, a step.
Are we supposed to be seeing your video?
Yeah, I just seen that.
So you'll just need to take your PowerPoint down.
Technology, right? Can you guys see that now?
Yes.
All right, let me find my. There we go.
And it's the same. I mean, it's the same. You're just not getting into somebody's car. You're walking into somebody's house, or you're walking into a hotel room with a stranger. I mean, they still hurt you.
Everything was fine and dandy until the first time I said no.
A guy woke up, realized I was black. That's what he wanted the night before, but he woke up, realized I was black, and all hell broke loose in the room.
Una de las veces que recuerdo, el hombre me apretó tanto la boca que me rompió los dientes.
He broke my wrist. I got my hair cut off. Sliced my face. I've had guns put to my head.
Thrown out of cars, beat with a bat, had guns to my head.
I remember sitting in the hospital, my chest was so heavy and I thought I was having a heart attack and I couldn't breathe.
I was terrified that this man who had just tried to kill me was going to come back and finish the job.
I was definitely afraid of being caught and found out. And if someone had said, I can help you on that day, especially on that day, I would have taken it.
I have this weird relationship with hospitals. Like, I'll go in for surgery because I like that they take care of you, and that's what I appreciated. I will say that the nurses I remember in the emergency room showed kindness and compassion, but nobody asked me anything.
People who work on the front lines, like health professionals, can be such an important time, especially in a medical field. That might be the only time that woman is away from her trafficker.
I think that's definitely a great opportunity for someone to be kind of a first line identifier. There was a lot of training that went to medical people, social workers in hospitals to identify, hey, this person might be victim of some type of child abuse or domestic violence. I don't really see much of that on the trafficking side.
When I had my daughter, walked 2 blocks in my socks to get a cab by myself and went to the hospital and so scared. And I remember they asked, would there anybody be coming? And he didn't show up. And then he didn't show up and didn't show up. And I was supposed to be checked out of the hospital like 11. He didn't show up till 5. And I'm just waiting there, have no money. You know, I think that would have been odd.
I had over 18 emergency room visits. I was a child. I was out there. I was walking on the streets. You could tell I looked young. I should have been in school. To them, I was a prostitute. They treated me like I was dirty and that I deserved to have this abuse happen to me.
One time I went to the doctor and I went to urgent care. I told him that I was a prostitute and I was scared of what I might have. And he was like, well, you obviously have an STD. And just gave me some medicine, told me to go home. It turns out that I didn't have an STD. I just had like a cyst that bursted.
I had just been almost murdered. Nobody came to talk to me. Nobody. And the X-ray technicians decided to sexually abuse me while I was there. All I could think was this is all I am. I mean, this is how it's going to be for the rest of my life. I mean, I'm looked at as nothing but an object.
Wanting to feel like someone cares about you, someone wants to help you, there's someone there who can and will and wants to take care of you. That's very human. And maybe that's the route. I think it's just trying to make that initial inroad and, that initial kind of identification that's important.
I remember the doctor saying, can I talk to you for a minute? And I was like, yeah. And he asked me, was I under a lot of stress? He asked me, are you going to be okay? I said, yeah, I'll be fine. I think that I'm overworked. And he said, are you sure? I couldn't tell him out of embarrassment. Like, I felt like I was a strong woman. I am a strong woman. He never guided me to any other intervention, but just his words and him knowing was important to me.
So a lot of things kind of happen in that one. That just kind of goes to show you. Hang on a minute. Any comments or questions or anything you guys can think about with it?
It's definitely a lot to process.
It was hard to watch, but and own your own part in where you may have failed as a healthcare worker too, to look back on some of those patients or interactions, but definitely truthful. It happens across the board, happens across the country. It was hard.
It is very hard to watch, but the great thing about this is this has all happened in the past and now we can all move forward. And it goes to show that a lot of you guys being here today and just getting this education that we can make a better future and a lot more help. And, do not be surprised or shocked that going through all this presentation that you're not going to think of a half a dozen of people that you've encountered before that could have been trafficking victims. They may or may not have been. But I mean, now we can definitely know a lot more to look for in different things. So, and I really liked what she said at the very end about the doctor. The biggest thing is she was kind of scared to tell what was going on, but the fact that someone just asked, the more interaction too that you will have with somebody, and you will probably have repeat people coming and going from your healthcare facilities, but the more interaction, the more they will eventually develop some trust with you and be willing to open up to you. So just because you have missed some things in the past, they were just opportunities for you to let them know you are a safe person. So hopefully they'll, be willing to come back at different points in times too. So 87.8% of trafficking victims will encounter a healthcare professional at some time while they're still in captivity. So the two biggest things to remember is that you're the third point of contact, and 87.8% of victims will encounter you. So more than likely than not, you will come in contact with someone that has been in some type of life of human trafficking. So when the victims do seek care, usually in an emergency, just after an assault, if there was some type of workplace injury, which of course they consider sex trafficking and labor trafficking their work, gynecological services, prenatal care, routine checkups, mental health, addiction services, pre-existing conditions, and also health related issues to the trafficking. And we're going to cover a lot of different information with these. Reproductive health, of course, there's some issues with pregnancy and miscarriages and abortions because, you know, a lot of times they may try to seek some type of birth control, but a lot of times they don't always give them birth control methods. One thing I did have when I worked with a local healthcare clinic here in my area called TRICAP, one of the nurses there brought it to a point why they contacted me and wanted more information was they actually had someone come to their health clinic. She said it was a young, and they didn't know that their clinic, everything's free services, so they don't actually like do making sure you are who you are and stuff like that, because that's part of their anonymity for service providers. But she's like, she was a younger lady. She thought she was over the age of 18, came in with an older gentleman who she said just was really off, kind of seemed controlling and different things and stuff like that. But they took her in to get, I think, an IUD so that she could not get pregnant. And so one of the things they brought up was fear that there might be more traffickers forcing their victims to go to such free clinics to get things like that. So there again, that's another area of expertise we need to kind of look into, helping with Planned Parenthood and different facilities and stuff like that. So. The ER is the #1 point of contact for healthcare. The other thing is, of course, clinics. Like I said, Planned Parenthood, the regular doctor, your urgent cares, different things and stuff. A lot of healthcare clinics. We have recovered a youth. She was 14 years old, went to a healthcare clinic, admitted to having had 42 different sexual partners, thought she had an STD, which she did have an STD, but one of the other red flags was she had 3 cell phones on her. And so that was one thing that all the elements together, why they called law enforcement to come talk to her. So here's some indicators we will go through. Red flags, if they're accompanied by another adult or someone who seems really insistent on speaking for them, very controlling, won't let them be alone. One thing that I have in my previous job, whenever we had someone that was really controlling, it was actually a domestic violence incident. She was staying in the hospital for a few different days. And one of the things they did was when the advocate came in to talk to the victim, they made the partner get out of the room, and they brought the advocate in like a doctor's outfit. So the hospital was just really smart by the way they got help into talking to her. If someone talks to you and there's a lot of inconsistencies in their story, that can be another one. They lie about age. If they have any signs of neglected healthcare needs, because some traffickers will take them to healthcare, some will not, because they're, again, it's liability and different things. And like that 17-year-old girl, that story I told you about her, the reason her trafficker left her there was because literally he thought she was going to die, and she was the liability he don't have to deal with. So he left her there and then knows that they'll just go find somebody else. So that's why sometimes they allow them to be neglected for any of their needs. If they don't have control of their own money or even their ID, false or no legal documentation, multiple hotel room keys. If you ever see a youth with multiple hotel room keys, that means they keep them for mementos. But I mean, I even say that no youth should ever have a hotel room key unless they're going from their hotel down to the pool. Would be the only, you know what I mean? So that's just should not be a common thing. Chronically runaway or homeless youth describes frequently relocation or lack of whereabouts, especially if they say they don't know the community very well, they just moved here. Keep all that in mind. Signs of branding and tattoos. I do have some signs of branding, some pictures. I'm going to show you some of those tattoos and jewelry. So I'll kind of cover that a little bit more. So they may carry a backpack with them. So teenagers nowadays do tend to carry a lot of backpacks with them. But I always suggest that they tend to be kind of stuffed with clothes that kind of looks like it's more than just an overnight bag, because they have work clothes and street clothes with them. Could be a good example. So there again, just a really large bag that they're carrying around. And they avoid eye contact with you. They have exhibits loss of sense of time, a lot of disorientation, confusion, panic attacks. There again, the mental abuse they suffer really definitely puts them into a lot of that. Exhibits behaviors of hypervigilance, paranoia, nervousness, submission. So one of the biggest things that trafficking victims are kind of taught and trained is to be very submissive. So even if you go and you're questioning and doing your general assessments and different things, if someone just seems overly submissive or like they're trying to answer questions in a way that makes you kind of feel like they're trying to please you, can also be another red flag with that submissiveness. Some other indicators of human trafficking during the interview process and assessment. They report an excessively large number of sexual partners. Individual under 18 expresses interest in a relationship with an older person because a lot of times the traffickers tend to be older than them. And so they want to be the number one to that person. They might use lingo or slang terms commonly used in human trafficking situations. So I did email out a list of lingo terms that trafficking and trafficking victims use because a lot of people don't use those slangs or lingo unless they're in that life. Like it's just not something people go around and typically talk about. They usually refer to like other people in their home as like sisters, sister wives, wifey wives, stuff like that, to definitely be aware. They may not know when or where their last medical examination was. That could just go because they have had such a distance between getting help and seeking medical care. Some more common signs to think about. Most physical symptoms are results of injuries. There can be reproductive history, STDs, pregnancies, and abortions. The 17-year-old girl that we worked with from Louisville, she did report that she had she says, I had been pregnant twice, but I was forced into abortions, or not abortions, but miscarriages with the children. She goes, the very first time, she goes, my trafficker punched me so many times in my stomach that it forced me into miscarrying the child. She goes, the second time I got pregnant, she goes, he tried to hit me and beat me as much as he could. I would not go into that miscarriage. And so he actually stabbed her in her stomach. And she actually showed us the scar marks she had from that. So there might be some issues with that as well. And there's other different things with like weight loss, malnutrition, loss of appetite, eating disorders. A lot of victims sometimes are forced to look a certain way. So they do go through those various different eating disorder type situations. Drug or alcohol addictions. Victims will definitely use drugs as a way to lower their inhibitions. They try to get them addicted. And also, they use that sometimes as a coping mechanism because living in this lifestyle and different things and stuff like that is something you don't want to think about, especially mentally have to deal with. So there again, it's just a form of victims getting through with what they're going through, that they get addicted to drugs that way as well. Other different physical assessments, if there's a lot of malnourishment, generally poor health, unexplained injuries, prolonged signs in different stages of their healing. This is, of course, that picture is a sign of a cigarette burn and a different stage of healing with it. But, if they have bruises and black eyes, bruises that are, of course, there again, different stages of healing to where they kind of look, some are really dark, some are really light, some are yellow, some are blue and purple, those different things that they could definitely kind of go through. Prolonged infections, there again, it can lead to lack of medical treatments, urinary difficulties, pelvic pain, any type of trauma to the vaginal or rectal, pregnancies. One of the big things you will see, especially in emergency room visits, is sometimes they come in because they have impacted tampons and they want help for removal because there again, just because you're in your monthly period doesn't mean you're allowed to stop working. So a lot of times they have to put something in and keep going to work. And then of course, being shoved too high into the vaginal area, they can't get it back out. So that's why they need that removal help and assistance. Chronic back, hearing, cardiovascular, respiratory problems, especially the longer the abuse happens, the more these longer type physical problems and stuff can happen with the victims. Serious dental problems. I have done a presentation before that was really interesting with some dental health workers, and they were blown away. But some of the extra things I looked up is being forced into having oral sex. A lot of times it can be a little more painful and violent, and they're not being very nice to the person. So the top palate sometimes can result in injuries of fractures. Broken teeth, broken jaw, can all different be signs that can go along with that as well. Of course, we kind of covered addiction and drugs as well. Specific to trafficking, so any type of overuse or related work injuries to any type of the victim's body, especially labor trafficking issues, can result there again those work-related issues. Because they're not allowed typical working an 8-hour shift or certain different things. They're forced really long work hours and to do jobs sometimes they're not capable of really doing. Ligature, strangulation, restraining injuries, sexual assault related injuries. The victims may or may not be wearing inappropriate clothing. And I always strongly suggest it may not be appropriate clothing for age or weather, but really age can be a big part in it. If they're trying to dress their victim so they look or to appear to be older, can be another one to look for as well. Because they're a minor, they don't want them to look quite as young. So that's why they may dress them in older typical clothes. They're again tattoos and branding, and I think that's the next slide that I'm going to show you is the branding. And then of course GPS and some sorts of tracking devices. So I have not seen a whole lot of that just yet. I have had a phone call one time where someone called me and he said, I have this girl here with me. I don't know what to do. I really want to help her. She said she's been trafficked in the past, and something was reported that she supposedly had a GPS tracking system. She said they gave her a drug and she blacked out and woke up with a cut on her hand. So she didn't know if they actually put a tracking system in her or not, but she wasn't really for sure, but it definitely can happen because this is a multi-billion-dollar industry. So they definitely want to know where their victims are at all points in times. So here are some tattoos we have gotten from various different victims. They can be on the back of someone's neck, might be on the lower part of their back as well. I've also seen them, of course, like you see in the wrist and on the arm. They want to make sure it's kind of visible to other traffickers because they want to let them know, the pimps and traffickers, that I own them, you can't have them. So that's why they mark their territory and brand them. So here you can see there's some numbers, there's initials, there's symbols. Daddy, they always refer to their trafficker as their daddy. So that's another big one too. If you know they're talking about someone as a daddy or a father figure, but it's not their actual father, can be another big one. So this ring here is just a small, simple promise ring. So kind of consider if you're ever working with like a 12, 13, 14-year-old girl, and they start talking about, I got this wonderful, amazing boyfriend. He loves me so much. He's going to take care of me. No one's ever treated me like this before. We're even going to get married. And they might start this promise ring. Then later you find out that they're like a 20, 25, 30-year-old man. Then you know that's a huge red flags right there. But yeah, sometimes they will give them that promise ring. Here's some things that people will say are GPS tracking systems. You can usually feel them under the part of the skin where they've been inserted, but they're really small and really tiny. They're again not even know that they're actually there. But like I said, I have not seen a lot of cases personally. I have had that one story, but there again, like I said, with this being a multi-billion-dollar industry, anything traffickers do is not going to surprise me because they want to know what's going on all points and times because they're again, that's their money there. Sadly enough, that's what they do. Also just kind of comparison a little bit with sexual assault and also with sex trafficking. I know this is really small and I sent this as another handout as well. But a lot of times with sexual assault, it can be usually one or a few perpetrators. Sometimes it's an isolated incident that happens once. Usually they're able to go get a forensic exam right away after the assault has happened and taken place. When it comes to sex trafficking, usually there's multiple perpetrators within a day, because unfortunately traffickers will sell their victims anywhere between 10 to 20 times a day. They can have minor perpetrators as well as adult perpetrators. Multiple sexual assaults all within a day. They're usually not allowed to get a physical exam also. So there can just be so many more different things and stuff that can happen with that. Multiple perpetrators, different things and stuff as well. So sexual assault, of course, can lead to sex trafficking, but it doesn't always necessarily mean the same thing as well. So long-term sequelae that kind of goes along. Sorry, I have a hard time saying that word. You have post-traumatic stress disorder, because with trafficking, a lot of them have been abused previously. So you have that layer there. And then you have multiple other layers of trauma. The more and more the victims are trafficked and the mental abuse and stuff they suffer as well. So we do also talk about some of the complex trauma. That's a little higher prevalence and more just your post-traumatic stress disorder that the victims go through. A lot of trigger responses and reactions. A lot of victims really talk about the disassociation where they kind of leave their bodies and different things. And that's also a form of coping. We have some subject matter experts that talk about what they've been through and their experiences. And even while they're telling their story, they will disassociate during that point in time. Paranoia, fear, a lot of anxiety. Trauma bonding is really important as well too, because they definitely develop bonds of trust. And a lot of victims will explain it as, I've never experienced so much love as I have with my perpetrators and trafficker. And so that's a lot of the reasons why they can't just walk away from that situation, because of that trauma bonding. Aubrey's story is a really good example too, because they gave her something she had never experienced within her family. And so she was definitely very trauma bonded with them. Other different things that, of course, can happen: difficulty with sleeping, staying asleep, irrational outburst of anger, difficulty, of course, concentrating, that victims kind of go through. Just until they can learn how to cope and deal with some of these are definitely a lot of things that they go through. Severe depression, suicidal ideation. We kind of talked about that earlier with one of the comments that we were made with suicide. So they definitely do have that, because they can't explain mentally what's gone through, what they've gone through, what they've dealt with, why it had to happen to them. A lot of self-blame, a lot of guilt that goes along with that as well. And so that's some of the things that build up from a suicidal ideation and attempts that they also have as well. Spiritual questions: why did this happen to have to me and stuff as far as that goes. Untreated STIs and STDs, sexual dysfunctions, and of course a lot of difficulty establishing and maintaining healthy relationships, because they kind of were never taught. Just especially the younger they are that they got pulled into trafficking, they haven't had a chance to establish and develop any of those. So they go through a lot of those different signs and symptoms of that stuff. So some of the things that you can do during the physical exam and assessment: assess and treating acute and chronic conditions. Documentation is so important. Of course, you don't want to document that it definitely happened or different things, and we'll kind of go into a little bit of that. But like I said, documenting is important. I'll wait to go through some of that. Assess overall health. Obtain a sexual assault evidence collection kit if possible. That's highly important. Testing for pregnancy and STDs. So some hospitals I know will do testing for pregnancy and STDs during the sexual assault evidence collection kit. Some will not. It just kind of depends on what your protocols are. Also screening for drugs and alcohol is part of that evidence collection as well. But yeah, if you can obtain a sexual assault evidence kit, that's really important. their time frame. So some screening questions, and these are just a few screening questions that I've put up there. I did not put them all up there because it makes this way too big of a screen. You can't read them, but I did send this out as an attachment as well. But some of the things you can ask the client or the patient you're working with: can you leave your work job, or if you want to, like, do you feel safe to leave? When you're not working, can you come and go as you please? Because this allows you what kind of freedoms they do have. Has anyone threatened you? What are your work or living conditions like? Is there a lock on the outside of your door or window? Because sometimes they might lock them or put an extra lock on them to punish them and stuff. And like I said, there's many, many more other screening tools and stuff that you can ask them. The main thing is like safety concerns and questions. Ask them what they are free to come and go if they do feel like they're captive in any kind of way, or they're being forced to do things they don't want to do, or those types of screening questions. In trauma-informed care is so, so important that we treat them with respect and kind of allow that victim choices and options. Now we can control some of those choices and options, but the more we can empower those victims, the more they kind of feel they have that strength to either get out of the situations or to open up about it. So try not to re-victimize, accept their behaviors. Sometimes acting out behaviors can be a form of coping. So if they're not as willing to like work with you, there again, those behaviors might be as a way of them trying to attempt to cope with what has happened to them. Choices and options, like I said. So what you kind of do in that situation, give them choice A or choice B. Like I said, you can still pick what A and B is going to be, but it allows the victim to make their own decision. And so that's what's highly important. Whether you tell them like you can, I'm trying to think of a good example that you guys would do in a healthcare facility. Like if you tell them that they can, oh crap. All right, different example. Let's just say you're working with a youth and you say, do you want to eat tacos tonight or do you want to eat hamburger helper? There again, you know you're going to make one or the other, but you're still giving them the choice of options of what they want to choose. Does that make sense? Okay.
Yes, it does.
Okay, thank you. Sorry, I was having a time with that. Be culturally very competent when you're working with somebody. And we have learned so many different things about different cultures and languages, gender identity roles, and different things and stuff as far as that goes. If you're not sure, just ask, I think is some of the best way. And there again, it kind of gives them a little bit of empowerment by asking them and allowing them to tell you what their preferences are. And that goes along with their own story and their own backgrounds. Know what your own prejudices are. We did see that video that was kind of hard to watch and different things, but if you don't feel like you're the best person to work with them, step out, and that's perfectly okay. I would rather you know how you feel about a particular information and topic. And if you don't feel like you're the best person, the best you can do to help that person out is get someone involved that feels more comfortable with certain things until you can learn or different things and stuff. And that is perfectly okay, like I said. Discrimination, perceived discrimination. And I'm going to show you a video about like changing sometimes our perception about different things. Victims do have a lack of trust. They trusted the trafficker and look what happened. They started being abused in those different kind of ways and being forced into sex trafficking or labor trafficking. Also, who some of the perpetrators were may also influence that lack of trust they may have. So they will not trust you right away. But if they start coming back, keep in mind, they may start develop more and more trust with you in those different situations and stuff they do experience. Victims, of course, in trauma-informed care, they need to know what's going on and be able to make the decisions. And language is so, so important. We don't want to say what happened to you, or we do want to ask them what happened to you instead of what is wrong with you. So there again, just how we term different things can be so much more important to help them through that process as well too, because it was not the victim's fault and different things. So that's why we want to, of course, put that emphasis on somebody else by saying what happened to you. We're addressing the issue that someone has done something to them. And of course, when you ask them what was wrong with you, that kind of addresses that it's something they may have caused or done. Some challenges in identifying victims may not disclose or self-identify, especially if they have not had any education about human trafficking. They don't understand it or don't realize what happened to them is trafficking. If you don't have very good screening tools or a policy at the healthcare place can definitely be another challenge. Of course, objective measures to diagnose trafficking. And of course, if you've never been trained in trauma-informed care, can be another one. But I think we're doing a lot better job in that trauma-informed approach in education and training. Victims blame themselves. They have a lot of embarrassment, guilt, shame. They believe they were criminals, especially if they commit a crime and had criminal activity during their time being trafficked and living that life. Like I said, a lot of them are established some type of quota that may lead to other different crimes they might commit to try to get that quota instead of just the sex trafficking and labor trafficking. So there can be other things that go along with it. Fear of law enforcement, especially if they've ever committed a crime and law enforcement was involved and it didn't go very well, they don't want to work with law enforcement very well because of that. Then, of course, there's always a fear of retaliation that, of course, the traffickers might carry through to different threats and stuff that they've gave them before because they don't know what they're capable of. So keep that in mind as well, that they definitely don't know what they're capable of. All right, let me see where I am at in my slides. I don't think this video is very long. Okay. Am I okay on time?
Yes, you're doing fine.
All right. Give me just a second. Okay, can't do it that way. Oh no. Sorry.
Take your
Fine.
time. I really,
Let me know if you need any help, but you're doing absolutely fine.
It's okay. Technology, you gotta love it. All right. All right. All right, can you see it now?
You just want to go ahead and, yep, you got it. So it's just a short little video that just kind of shows
I mean, can unfortunately be some of the realities to stuff that, of course, people will sometimes look at different situations. And I know you guys have had so many and you do such great work that you do, but sometimes, there can be a little bit of like burnout and stress and different things. So sometimes I think that video is just really good to kind of show you how important it is sometimes just to take those extra few minutes to just kind of ask someone extra questions and make sure that is definitely, being presented why they're actually there at the emergency room, what they need help for and stuff like that. Instead of just assuming maybe that, well, they're just here to get whatever and just get out from that situation. So like I said, just nice little short video. And we talked about a couple different things too that I think Deanna brought up about body language and asking questions. And sometimes it's how it's perceived also by the person that we're meeting with, how they might react and respond to. So that's why it's important just to take those extra time to do some of that stuff. So.
Christina, I just want to interject here. As a therapist, I actually really appreciated that short video because yes, the perception of people, I see that unfortunately sometimes with staff I work with, and that's something I would love to continue seeing change. People are sometimes jump in judging the outer look of somebody rather than, and then really trying to understand where that person is coming from. So thank you for sharing that short video.
Thank you for your comment. I appreciate that. Okay. All right. So the biggest thing is, what do you do? So as healthcare providers, you are, if anyone's under the age of 18, you are a mandatory reporter. So you do have to report that to DCS, and I will give you that number. First thing we do suggest, so handle these situations individually as they kind of come, because some people are going to be in imminent danger. And yes, we need to call 911, and we do suspect that imminent danger. If you feel like for some reason, if you contact 911 and get them there, it may put the person at a greater risk and harm. It may not be the best thing to do. And so that's why we need to take other situations and give them resources. They did. Okay, if we're under 18, you do have to report it to DCS and make that phone call or call local law enforcement. If they're over the 8, and this is DCS number, and we do highly suggest that you tell them you suspect human trafficking when making the DCS hotline call, because they will ask you additional questions they don't normally ask for abuse and neglect cases. So the more information you can give them, the better they are. They did change the law because they actually had it to where any type of human trafficking, you were a mandatory reporter, which means you had to call 911. But now you don't. If they're over the age of 18, as a healthcare practitioner, you do, however, have to provide them with human trafficking information, even if you suspect they are a victim of human trafficking. And that is simply by giving them a national human trafficking hotline number or some type of resource to that person. You do not have to call it into the police or do anything if they're over the age of 18, but you do have to give them that information to make sure they have something when they leave there with a resource. And the other different thing too, because of HIPAA and mandatory reporting, of course, like I said, if they're under the age of 18, you're reporting that abuse, neglect, or domestic violence. It does record, which I don't know why. Yeah, we do have to report that, but you do not have to report any type of human trafficking over the age of 18. Just give them that information.
Christina, this is Becky. Do you know what those additional questions are that they will ask so staff can be prepared?
It's usually, oh gosh, because I mean, it's a lot more questions, but it's more related to like trafficking than it would be abuse or neglect. So that's going to be like, do you know what hours they're going out and working? Do you know typically what are the types of abuses that sex trafficking is, labor trafficking? Who's their trafficker? Are they free to come and go?
Gotcha.
Trying to think what other specific questions they ask. I have a form.
That'd be helpful.
Hang on.
Thanks.
Because I made a cheat sheet one time, so that I could actually fill it out before I made the phone call, so I could track the information. I can share that if you would like to see that.
That'd be great.
Yeah, let me make a note for that. This is the National Human Trafficking Hotline number. So there again, if you just have extra questions, didn't know what to really do or how to maybe proceed with the situation after someone's been in the emergency room, or make sure you did what you were supposed to, you can always call them for information. You can also, encourage the victim. You can call this number with them is another option as well. They are a language line. So if someone's not very good English speaking, this is a really good resource to be able to have an interpreter as well. So 911 is also available for text in case anyone ever does need that. It is an additional resource. They gratefully give us some money to help with some of our training. So that's why we definitely share this information with the whole state. And then response protocol development. So this is something that's really big that I know a lot of people do not have an actual protocol for human trafficking. So we definitely want to encourage you to start thinking about this. And this is something your ITVAP regional coordinators could assist you with, but all victims' needs are totally different. One of the big one we face is housing, because there are limited resources when it comes to housing human trafficking victims. Therapy, counseling, immigration services, interpretation services, support groups, life skills, vocational training, because a lot of them never got to have those types of things. And then of course, substance abuse treatment is another big one as well too, because we know there's a high connection with substance abuse facilities. And it does take community support for change. We all have to work together. We cannot do it as an individual. Because they do have so many different opportunities and needs that we all have to be able to definitely know who has the availability to help that person. Plus, we want to make sure they are going to the best available services to them, because if we send them to someone that's not received any training, they might do more harm than good. So we want to make sure we are all connected and working together for that. For your protocol, you want to make sure you're addressing any mandatory reporting requirements. Plan how to offer assistance to victims and different things that you want to be able to give them. Who do you contact? Who do you call? What resources are available? It will also minimize trauma to the patient, maximize all your safety for the patient and the staff. Especially, do you have to alert if the perpetrator or trafficker is there with the victim? Do you have to alert your security or law enforcement? Is that part of your safety plan? Do you have an active SART, sexual assault response team? Because they are going to start focusing also on developing some human trafficking protocols as well. And all these protocols can definitely improve success for intervention. Designate people, and I know these are just examples. Sometimes you will have SANEs or safe nurses within your facilities. You will have trauma-informed trained social workers. Even chaplains within your facilities are sometimes good to be part of developing the protocol to make sure that all those different areas and stuff are being thought about and being covered. But just make sure that you do have people available for all your shifts that are trained in trauma-informed and human trafficking, even if it's just one person in your facility at the time. Because it'll definitely help to know how to handle these different situations and to identify the best things possible. This is a toolkit with Hope for Justice. That is a resource that you can download to help you develop also your protocol and toolkit. It's very long. It's a big booklet, but it is something that is a really good resource to have when it comes to that. And we have other examples too as well. Here are some additional resources, and you guys should have all these in the materials. I sent the PDF form of this PowerPoint. So like I said, you should be able to get these resources along with the 10 slides of references that we used when this PowerPoint was created. ITVAP, We call, instead of calling it the Indiana Trafficking Victims Assistance Program, we do call it VAP for short, because that is a mouthful to say. Like I said, we do have 10 regions. This is our current region map. We have different shaped regions because we wanted to focus and make sure we were getting the most services available for the communities that definitely wanted us to be there. So those are really important. Why our sometimes region map looks so weird. We do training and outreach. So if anyone wants any further information, I'd be happy to come to any other organization you might be involved with, not just healthcare, whether it's the community, whether it is working with law enforcement, community, social workers, educators, youth working agencies, whoever it is, we are more than willing to talk to whatever group. We do a lot of network building, so I do attend a lot of meetings that focuses on youth, substance abuse, or homelessness, because those are really big highlighted areas. We offer victim service reimbursement for our service partner providers because this is a lot to take on, and so we want to make sure there is some resources available. We also do case management and coordination. So we do not offer at IPVAP ongoing client services, but if someone is presented to us that is a human trafficking victim, we will work with whoever the team is to make sure they get the best services possible for the community that they are in. Because we do still have limited services available to them. So we want to make sure we get them connected to what is best available. Indiana also has a statewide task force called IPATH, which they do have a healthcare working group. I'm going to send Deanna the information of who the chairs are for that group if anyone would want to get involved. They are working on a more prevalent PowerPoint. Mine is just pretty basic that I want to get out, that at least information to get out there. But that is some of the things that they are definitely working on, and they work very closely with other different agencies to make sure that information is shared out there. They do also have regional task forces. So depending on where you are, look into and let me know if anyone is interested, and I can try to get you connected to what regional task force is available. And as we are doing more presentations, we are starting to identify more and more victims. And then, like I even said earlier in this presentation, I would not be surprised if you guys are not thinking about someone you've come across in your past that you could have potentially thought would have now be a human trafficking victim with this education, because we do see that happen quite a bit. So I'm gonna skip that video. So I don't know if you guys are doing an evaluation for this, but I do have a quick evaluation if anyone does want to complete it at this link. And then this is the code for it, which I can put that in the chat. So you guys do have it, maybe. But this is also my contact information. So if you guys at any point in time, even though you may not be in my region, if you have any questions or anything you can think about, you want me to connect you via email or however with your regional coordinator or someone else, please don't hesitate to reach out to me. I would definitely be happy to get you connected to whatever services are available. Is there any questions about anything that I have covered or talked about?
Or thoughts? And again, you can unmute by hitting *6, or you can press in the participant list, the little microphone, you can click on that and it will unmute you as well. This was a lot to take in.
That's a lot.
Thoughts? Was this helpful?
Are you guys really overwhelmed?
I do have one question, Christina. With some of the teenagers I work with in therapy, one of the trends I know that's out there is, playing these online games where they're connecting with people they don't know. Are you guys seeing that that's a way that trafficking is happening, where, these teenagers are making these connections with these potential people that are grooming them over these gaming?
Absolutely. And I normally really say that, and I'm sorry I didn't say it during my presentation, but kind of thinking about how males are sometimes targeted and trafficked, and that's what they will do is they will go into these online gaming systems because we don't think about traffickers being there. But just imagine a young boy playing, and all of a sudden you as a parent go in your kids' room and yell at them, get off the computer. It's time for you to finish your homework. It's time to go to bed. But you have someone in that other room that overhears that and says, oh man, my parents are always on my case too. I don't understand it. What time are you going to be on tomorrow? So now they've done made that connection. And so they might get back on to the next day and different things. And so like even Aubrey said, it takes 6 months worth of time that they get involved, and so after 6 months worth of time of just simple, small chit chat with someone, you learn a lot about that person. And it starts out really small, like, oh, well, what school do you go to? Or, are you an only child? Or, are your parents still married? And they don't ask them all those questions at one time. So that's why it's kind of tricky. So yeah, online gaming can really be another big one for traffickers. So. Any other questions?
And I just want to reiterate, feel free to reach out to Becky or myself. I know we're getting some messages about things your individual hospital needs, and we're glad to coordinate that with our speakers and presenters and other experts in the field. So we're glad to help in any way. So reach out to us. Also want to share that S.E. Smith says it's very informative and educational to think about all these different situations. I know you've already had other people saying we need to get this education out to more hospitals and thinking of that. So I think we're having, it's got everybody really thinking a lot. And so I'm sure, Christina, that you and your team are going to be getting some reach out from the hospitals to work on addressing this issue.
And that's okay. That's what we're here for. So.
And Christina,
So grateful to you, Christina, as well, for everything that you shared, the information that you gave. I'm so thankful and grateful to be partnering with you and your organization as well, and getting involved in whatever way possible.
Thank you. We're glad to have you too. That's highly important. I'm glad David connected us.
And Christina has shared the evaluation and the code in the chat, so we'd appreciate you filling that out. As Elizabeth and I meet with each of your groups to develop the action plans going forward, we're going to be asking for feedback on the education that was provided. And so give that some thought so we can build, and if there are additional things we need to provide in the future, we'll be glad to do that. Deanna, our next session is you, and it's body brokering. I don't know if you want to give like a little teaser, but this is definitely a session that you don't want to miss, because as Deanna opened up our eyes to this type of human trafficking, I was astonished. I just did not realize this went on. So Deanna, do you just want to just kind of share a little bit about it before we take a break?
Yes, absolutely. Thank you so much. And if you thought you were overwhelmed with the information that was presented this far, and trying to absorb it, you're definitely going to need this break. So I'm about to open your eyes and present a whole new topic and a whole new world on human trafficking that occurs in addiction treatment centers, in detox centers and rehabilitation centers. Again, I have a personal story with this. I will share a little bit of my personal story about this and how I was made aware of it. And I thought I knew everything there was to know about substance use disorder, addiction treatment centers, detox, and wow. You don't know what you don't know until you know it. And then when you know it, it takes on a whole other perspective for you. So yes, a lot of exciting information. I say exciting, and I even hate using that word exciting because it really is very disturbing actually, information that I'm going to give you and share some pieces and tidbits with you. So definitely take your break, go to the restroom, get a drink. Again, trying to make this interactive and as fun as possible. I'll do probably just a little brief intro of some music to pump you guys up when you come back, so we can settle in for what we're about to experience, so to speak. So that's all I have.